Hello, this is David Applefield in New Jersey's 4th Congressional District. I spoke to Dr. Anita Goel from her laboratory in Cambridge, Massachusetts, about a breakthrough invention, gene radar, which detects diseases, including COVID-19, in real time from the comfort of your own home at a very low cost. Ready to bring gene radar to New Jersey, where deaths from the coronavirus are second highest in the United States, Dr. Goel explained how it works and how we must use advanced tools to fight World War III. Public health.
If we want to get ahead of this disease, number one, slow the spread, and number two, reopen our economy, I think we're going to need to do mass testing on a large scale with very high precision testing. So there's a lot of testing out there. Not all tests are created equal. So there's some tests that may be good for certifying that somebody's immune and has antibodies, but doesn't tell you that they're not shedding the virus. So I'm advocating that we need a highly precise testing. So if we want to reopen the economy, people have to feel safe getting back on an airplane, going back on that cruise ship, going to a football game. All those things are going back to school or college. It's going to require people feeling safe that there's no COVID. So creating COVID-free safety zones for travel and work. And I think that a next generation type of technology like gene radar that enables real-time nanoscale precision testing is going to be part of the answer to reopening the economy. The COVID crisis could last easily another 18 months on a global scale. So we're going to have to, in my opinion, invest in upgrading America's technological infrastructure and our world's infrastructure to deal with pandemics and biowarfare threats such as what we are facing now.
Well, will people ultimately be able to be using their own device, their own smartphones as a tool in testing and controlling and understanding their own personal health?
I think that is certainly, when we won the X Prize, certainly the vision behind this drive in our technology. I think our technology starts to enable that. However, I also respect the guidelines from the FDA and the CDC as to what they and what we as a society feel comfortable giving the rights to people to self-diagnose.
If you were able to mobilize the funding needed and had and worked in partnership with, for example, Governor Phil Murphy of New Jersey, would you be ready to bring your gene radar and nanobiosim solution to New Jersey within the next weeks, or days, if you had the support that you needed?
Absolutely. I mean, we would work in close partnership. I think the first solution we would provide is testing as a service. So if you compare to like a company like Uber, we wouldn't be selling the taxi, we'd be selling the ride. I think that's the easiest way to get the maximum number of people access in the shortest amount of time. And then over time, we would, scale up from there. But I think we would be delighted to and honored to be able to serve in the current crisis and help as best as we can, move as fast as we can move forward.
I'm devoted to bringing, talented people who are doing have breakthrough ideas together with those who need it. So let's just say what's really needed here. Basically, you need a commitment of about how much money do you need and how much time to create what results that really would be a game changer in addressing COVID-19 right now?
Well, so we've built a few different budgets depending on what scale we create, anywhere from 25 million to 250 million to get from the first 10,000 tests all the way up to the first 5 million tests. And within first milestones within 30 to 60 days, then 60 to 90 days, then all the way from 100 to 300 days.
As you've been watching over the last weeks and month and a half, as the pandemic has taken over and completely disrupted and created tragedy after tragedy, and both in terms of human life and economic stress, and for many families and towns. Has this been a source of tremendous frustration for you because you know that there are, or has this been a wake-up call that we needed, society needed, and countries needed to realize that we are on the brink of entire new ways of developing and creating health systems to respond to our needs?
I would say it's been both. It's been definitely a source of great concern for our fellow humanity, for society. Um, I wrote in an op-ed I did in Scientific American some years ago that the current generation of infrastructure and the centralized model of healthcare that we're currently living in is basically inadequate. There are 4 billion people on the planet who don't have access to that healthcare, and here in America we have a multi-trillion-dollar healthcare crisis looming. And we're going to need a upgrade in our technological infrastructure for delivering healthcare in order to really solve those challenges, as well as deal with the in an increasingly globalized economy where infections can travel at lightning speeds. We need a whole new kind of technological infrastructure to protect ourselves and protect our healthcare systems, our economy, our way of life. And I think it's really critical that we, now that the technology is getting to the point of ready for launch, that we as a society step in and make that happen. As you may recall, in World War II, it took a Manhattan Project to take a technology that was still kind of in the lab and get it all the way to what helped us win World War II. And I think you got to look at it something like that. We have this advanced nanobiophysics technology that I and my team have been working on for many years, with help from DARPA and other agencies and other players. But we're now at a point, in order to scale it, it's going to take a bigger effort. And it's also going to take a paradigm shift in how we deliver healthcare. That means policy change. That means a number of stakeholders in our healthcare system have to embrace that we can deliver better, faster, cheaper healthcare by making it more decentralized, more personalized, more mobilized.
And
I like to say we're doing for healthcare what Google did for the information industry, cell phones did for telecom, perhaps Apple did for the personalized computing industry, which is a radical decentralization, mobilization, and personalization of the infrastructure needed to deliver healthcare.
you personally believe that we're going to be faced with this same degree of threat daily in our streets, in our towns, for how long?
Well, a lot of it is a function of how we react to this. But I do believe that we should be prepared that at a global level, this menace of this virus could be with us for at least 18 months. Even if we get pockets where it sort of temporarily subsides, it could come back. And as you saw, how fast the virus can travel from one part of the world to the other. So I do think until we develop mass testing, where something like a gene radar can go and at a mass scale test anyone, anywhere, anytime, and map that data on a global centralized surveillance basis, we are at risk for the reemergence of this virus or other viruses on a very fast time scale. And I think this pandemic has just revealed how vulnerable we as a nation and as a society are to not only pandemics, but future biowarfare, bioterrorist attacks, where people understand that, there's such a vulnerability. So I think it's really high time that we protect ourselves and our country and our society by building a new generation of infrastructure.
So let me just conclude with that, since you've come back to this a number of times about security and about warfare, and we're hearing an elevated and escalated discussion and name calling and finger pointing, and it seems like there's an underlying information war between China and the United States. Do you personally feel as if the COVID-19 was created in a lab and was either accidentally or deliberately let loose?
I don't have enough data yet to comment one way or another, but I do believe that it is a matter of national security and global health security that we as a nation and also as a human species work together to protect ourselves against these kinds of infectious enemies. I've been saying that for years. I believe that technology comes from the nexus of nanobiophysics, which enables a way of doing this kind of testing on smaller scales with lesser reagents for cheaper cost and faster turnaround times, and makes it possible for anyone, anywhere, anytime to be tested. And that's not only good for wartime situations, I mean, war against a virus, not against people, but also in peacetime situations where you want to create a new generation of health and wellness. You want to have people empowered to take ownership over their own health, because then they're going to do a much better job in making the right choices. So I see this as a solution that has to scale no matter what. It's just that emergencies, unfortunately, like COVID, reveal to us as a society how urgent it is for us to upgrade our paradigms and our technological infrastructure to deal with these kinds of issues.